Hello and welcome to the Pharma Learning channel. In this episode, we'll be covering atopic eczema. Atopic eczema is the most common type of eczema. It's usually a chronic condition where the skin can become dry, itchy, and sore. Flare-ups are periods when symptoms get worse. For mild eczema, emollients should be used liberally, even when the skin is clear. A mild corticosteroid like hydrocortisone 1% can be used to treat red, inflamed skin. There are a variety of emollients available. They contain different ingredients like urea, laromacrogols, lanolin, and antiseptics. Brands include Oilatum, Balneum, and Dermal. Generally, creams and lotions are better for red, inflamed skin, and ointments are preferred for dry skin. Ointments dissolved in hot water are suitable soap substitutes. Bath additives and shower products are an option for patients with extensive areas of dry skin. If bath emollients are used, they should not replace standard emollients. Patients should be advised to continue using standard emollients in addition to any bath emollient products. Emollients are a little underrated. They should be prescribed in generous amounts and applied regularly, often 4 times a day. As a general rule, the amount of emollient used should far exceed other topical treatments like corticosteroids by a factor of at least 10. Emollients work effectively when the skin is moist, like after a shower, as it helps trap moisture in the skin. Patients should wait about 30 minutes after applying an emollient before applying a topical corticosteroid to allow the emollient time to absorb. Ointments are greasy, so they may be more suitable to use at night, whilst creams and lotions are better during the day. For moderate eczema, emollients are still used. If the skin is inflamed, a moderately potent topical corticosteroid like betamethasone 0.025% or clobetasone 0.05% is recommended. Hydrocortisone 1% 15-gram cream and ointment can be purchased for adults and children over the age of 10 years in a pharmacy. Eumovate cream 15-gram containing clobetasone 0.05% can also be purchased for adults and children, but over the age of 12 years. If the skin is very itchy or the patient has hives, then a non-sedating antihistamine like cetirizine 10mg, loratadine 10mg, or fexofenadine, available commonly as 120mg and 180 milligrams, can be prescribed. Both cetirizine and loratadine can be bought over the counter. If itching is affecting sleep, then a sedating antihistamine like chloramphenemine can be used. This can be purchased over the counter. A common brand is Puritan. In severe, extensive eczema, a short course of oral corticosteroids can be prescribed, such as 30mg prednisolone taken in the morning for 1 week. Potent corticosteroids like betamethasone 0.1% and betamethasone 0.05% can be prescribed. Clobetasol 0.05% is considered to be very potent, reserved for severe forms of eczema. Topical corticosteroids should be applied sparingly to avoid side effects like skin thinning. They can be prescribed as fingertip units, FTUs for short. This is the amount of cream that can be squeezed onto a fingertip. 1 FTU is approximately 500 milligrams. The amount of FTUs varies according to age and the area of the body being treated. For eczema flare-ups, topical corticosteroids should not be applied more than twice daily and should be used for 48 hours after the eczema has cleared. Topical pimecrolimus and tacrolimus are options for atopic eczema when corticosteroids are unsuitable, for instance due to side effects or ineffectiveness. Dry dressings are helpful in severe eczema. They help reduce scratching and prevent emollients being rubbed off skin. However, dressings like this should not be used if infection is present. Areas of skin affected by atopic eczema can become infected. Signs include yellow crust on the skin surface or fluid oozing from the skin. Flucloxacillin is recommended first line to treat infections like this. If flucloxacillin is unsuitable, say due to penicillin allergy, a macrolide can be prescribed like erythromycin or clarithromycin. If the infection is localized, topical antibiotics may be more suitable, such as fusidic acid. This is also available combined with hydrocortisone and betamethasone. These are usually used no longer than 2 weeks. Until next time, thank you for listening. Don't forget to subscribe to our YouTube channel. You can also find Pharma Learning on Instagram, Twitter, and Facebook.